Hi guys, this is the boss Brittany, as you already know from 90 Day Fiance, or you may not know. But I'm here at Basu Plastic Surgery because I'm trying to get my boobs done again. So let's see what happens, guys. Let's go.
Are you getting excited?
I'm super excited.
Good.
I'm gonna have cute boobs like you.
You are I'm so excited for you. You're gonna love this. Like, truly and honestly, it's amazing. You'll be able to actually go braless. And they stay exactly where they are. You are gonna it's gonna be the best thing ever.
I literally can't wait because I got my implants done a few years ago.
Yeah.
And they're already kind of bottoming out and sagging. So I found this procedure and it looks very promising. So I'm really excited to get my boobs just reconstructed.
Good. Yeah, the internal bra it's an incredible thing. Especially when you've had implants, that's what just can happen. They can weigh the skin down, cause things to kind of stretch out, be in places they shouldn't be. So this just kind of perks it back up, keeps it exactly where it is. And it's a long-lasting alternative to things. So you're gonna do really well. You're gonna love this.
I'm excited. So what do you feel like? How are you feeling with everything? Do you think it's super worth it? Because I'm a little nervous, so I just want to ask you.
100%. So I mean, this was the third time that I had to have my breast done. So I had saline implants for a while, and they're just really heavy. I didn't like them. I switched to silicone. They totally bottomed out on me. That was my issues. My implants just wouldn't stay where they were. I had to always wear a bra. And I was like, this isn't what I signed up for. I want to be able to wear a cute outfit with, not having to wear a bra and have the cleavage that I wanted. So third time around, I was like, all right, we're going to do the internal bra. And it was the best thing ever. I've had it for probably a year and a half now. And it's a game changer.
Yes.
Absolute game changer. Totally worth every bit of it. Absolutely worth it. You're going to love it.
I'm so excited. They look so good. I just can't wait to be
yeah, it makes a little bit bigger. You'll have that nice cleavage up here, and it stays there, so you don't have to wear a bra. You've basically got one on the inside.
Yes.
Just kind of keeping your implants exactly where they should be. No more bottoming out, nothing like that. It's awesome.
I'm so ready.
Good.
Thank you guys so much. I love it here. This office is beautiful. And it's just so welcoming and friendly. I feel like I'm in an office full of friends and family. So I'm not feeling as nervous as I did probably when I had surgery before. I actually feel a weird calmness. I feel like I'm in good hands. So I can't wait for you guys to see the process and how it goes along. But you guys are here with me, so I'm pretty sure when I have my Boss Gang family that you guys are going to support me and make sure you give me all the love. So I'm looking forward to it. And make sure you guys keep checking out how these episodes go along and how my recovery goes, as well as my surgery with Basu Plastic Surgery.
Action.
Hi guys, so basically I'm in here by myself, so I take my mask off. You guys probably don't know, but I had F-cup boobs before, and I got a reduction when I was really young, about 21, because my back was really hurting. It left me with some really bad scars, and I was not happy, and I felt like my boobs weren't big. I felt, kind of not feminine. So what I did was I went and I got implants put in, and I feel like I rushed it. I did not do my research, and my breast kind of bottomed out, and I was still left with the scars that I was not happy with. So I've been waiting, and I finally found Dr. Basu, and I did my consultation, and he basically walked me through everything, and he was so thorough, and I feel very comfortable having my procedure with him because he told me all about the skin on my boobs and how having the procedure has thinned out my skin, and he told me all about the Galaflex and the internal mesh bra and how it's going to help me moving forward and give me that result that I'm looking for. And he's also going to help me remove my scars, which is something I was so self-confident I was so self-conscious about. So I'm really excited that he's going to be able to help me through this process. And I'm going to get ready to do my pre-op. So I'm going to come back and talk to you guys when it's time for me to go and let you guys know how the pre-op went. Thank you. So now I'm just waiting on Dr. Basu, and he's going to come in and do a consultation for me and let me know how my new boobs are going to come along and what he thinks about these boobs that are going to be gone soon. I'm excited. Let's see what he can do for us, okay?
All right, so let's take some measurements here. Okay, so we're going to take some standardized measurements. Sternal notch to dimple distance measures at 21. 21. Our nipple to full distance, currently nipple to full distance measures at 13. On the right, 13. She's at 14 on the right. That's the caliper measurement here to get some distance. Okay, her base width currently is at 14.5. She's at 14.2. Intermammary distance currently measures at, she's exactly at 2 centimeters. And desired height, we just did this morning. You're exactly saying height needs to be about 13.2 or less. 13.2 or less. Okay, Brittany, what I'm going to have you do is I want you to take one hand or both hands, and I want you to show me what, while you're looking in the mirror, I want you to show me what you're trying to accomplish in terms of your cosmetic goals.
Okay, so for sure, I want my boobs to be definitely higher, and I want them to be like closer together. So I want that fullness up here. I feel like my
They're
boob,
dropping down.
yeah, totally dropped, and the side boob is like down here when it used to be kind of
Higher up.
here. So that's what I'm looking for. Some cute side boob and that pushed together.
Up and higher up. Okay.
Yeah.
So one of the things that I always talk to patients about is, what is it whenever we do an augmentation or an augmentation lift or a lift, what is it that holds the breast up, like you're showing me, when we do these procedures? And it's really tissue quality, right? And we can tell when I was doing the exam for you, you've got some weakness in your tissue. You've had a prior reduction lift before. When you had large breasts before, the skin likely got stretched out. So we're dealing with some weak tissue. So what I'm going to recommend for you is we do a revision augmentation with a lift to tighten up the skin, but we need to do much more than that, because if I depend on just your tissue quality, you're going to sag back down, especially if we go with a nice full implant. So to achieve this sort of result, I need to do something else besides just using your tissue. And that something else is the internal bra technique. And that's where I'm using something else, a material that I like to use is called Galaflex. Galaflex is made out of a suture material, slowly dissolves over time over the next 18 to 24 months. If you look at my hand, the Galaflex is essentially going to be anchored to your chest wall. The upper edge of the Galaflex, where my thumb is, gets anchored to your muscle, so that creates a push-up bra effect to kind of give you this upper pull volume, and we're not depending on your tissue quality. We're actually depending on the Galaflex that is anchored, this material that's anchored to your chest wall and anchored to your muscle to give you really good support to keep the implant up in the position where you want it. I will, of course, do a revision lift to tighten up your skin, reduce the areola, and to correct this bottoming out to really reposition your breast. What we're really doing is we're re-engineering your breast. We're raising your full position, because as you can tell on your exam, the breast sits fairly low on your chest wall. You get a tall chest wall height, the breasts sit very low. And what I'm really doing with the internal bra technique is raising the footprint of the breast higher up so that it sits up here.
Yeah. It definitely makes my body look a lot better when you
lift it up, right?
Yeah.
So what we're really talking about is you need more support to help support your implant, support your tissue, so that your breast essentially sits a lot higher on your chest wall.
Definitely. So something like this will like prevent me from having to keep going back and get revisions and, you know, to lift the breast back up, because I haven't heard of this before. When I go to another doctor, they always say, oh yeah, we can do the lift, but in a few years you might have to come back, and that's something that I don't want to keep going under the knife.
Sure. So this should give you a much more long-term result, because we're not depending on your skin. Of course, it's cosmetic surgery. Your body may change over the next 10, 20 years. You may need some revision surgery. That's clearly possible. But the real reason for revision surgery is purely cosmetic. If you're happy with your breasts, the way they sit, the way they're positioned, your volume, you're doing your well woman exams such as mammograms and ultrasounds, and everything's fine, there's really no reason for revision surgery. But implants don't last forever. We're gonna do the newer, safe, smooth gummy bear implants, but implants are medical devices. They don't last forever. So down the road, whether it be 5 years, 10, 15, 20 years down the road, you may need a revision surgery for your implants.
Okay, that sounds good. Thank you so much, but I'm really
You're welcome.
excited about having my full cleavage.
Absolutely, and I'm excited to be your surgeon because I know I can give you a transformative result. And what I'm gonna do in the operating room is take a lot of pictures. What I love to do when I do these intra-broad techniques is finish one side and leave your own side as your before. And I'm gonna take that picture showing one side done, one side not done. Because that's your own real before after picture. And of course, we'll take the end result photos too.
That's gonna be amazing. I know you guys can't wait to see that picture. So I'm gonna make sure I include that in this video as well. But I'm really excited because I am so self-conscious about the scars that I have, for sure, especially. I go to the beach a lot and I like to wear lingerie in my pictures. I try to be sexy, so I feel like I'm so young and I'm too young to have the scars like look like that, you know what I mean? So I'm just really excited to just feel young,
Get the upgrade.
feel happier.